about Dementia Conversations. My name is Cindy Sheriff, and I'm a volunteer educator for the Alzheimer's Association, Southern Indiana and Kentucky, and I'm honored to be here today. I've been doing these programs for a couple years now, and I lost my father in 2018 to Alzheimer's, and the Alzheimer's Association was so helpful during that time. I felt like this might be a way to give back a little bit. So anyway, as we go through this today, like was said, if you want to wait, and I'll try to leave some time at the end to answer any questions that you might have. So as we talk about dementia conversations, these discussions are not easy for you or for the person that you're having them with, because we fear that we're going to hurt somebody, that we're facing changes related to aging and dementia. And it's hard to find the time that is right to have these conversations. But the sooner these discussions take place, the better. This way, the wishes of the person with dementia can be included as a possible, and also to deal with unexpected situations that hopefully you can avoid in the future. So as the person progresses with Alzheimer's, their changes do change, and that is often a signal that it's time to start the talk. And we've heard from many people who tell us that some of the most difficult conversations they've had with their parent or their family was about going to the doctor, deciding when it's necessary to stop driving, making plans for managing finances and legal documents just to make sure the person's wishes are carried out and the cost of future care needs are discussed. So keep in mind that as we talk about each one of these conversations, we're going to offer a variety of approaches, but not all of these approaches will be appropriate for each person. The approach that works best for you will involve you customize it to fit the needs and preferences of the person and your family. Sorry, this is moving a little slow today. So during today's program, I don't know why that's not coming up. So during today's program, we're going to provide you some tips for breaking the ice and having that difficult conversation. Help you plan ahead and build a care team that communicates, and give you an opportunity to hear from people who are dealing with similar issues and connect you with some helpful resources. And I'll also be sharing with you some of the tips and things I learned from dealing with this firsthand. So you may not think of yourself as a caregiver, but you may be noticing changes in the person that you care about, and that's causing some concern. So sometimes we find ourselves avoiding or talking ourselves out of this difficult conversation. I think that's just human nature. Sometimes we think, well, our family members say they don't need our help, or we assume that other family members who live closer are going to be taking care of things, or we fear we might take away the person's sense of independence. And these are all very common fears. And we also sometimes think there might be disagreement within that family. But the sooner is much, much better than later. So don't wait to occur before you have these conversations. You can actually avoid a crisis by talking about these issues and taking action in advance. And by talking early in this disease process, you'll be able to hear directly from the person with dementia or Alzheimer's about his or her wishes. And while that person still can communicate and be part of that planning process. So despite the difficulty of these conversations, they need to take place to ensure the person's safety and well-being. And these conversations are a success if you can plan in advance. So you try to develop a plan to how to finesse the conversation, how to introduce the topic in a way that'll be gentle and minimize the resistance. And we use this word finesse, and it really sometimes can go a little bit beyond honesty because it involves understanding how difficult this conversation can be and thinking about how best to gently position for the most positive outcome. For example, ask the person whether he or she would want to know if they've noticed any changes in functioning. In most cases, the person is going to say yes. That opens the door for you to begin to have this conversation. Sometimes they'll say no, that he or she would not want to know what you've noticed. At that point, you need to focus on the fear that is accompanying these changes and how important it is to talk about these changes. The actual conversation about the changes you've noticed may need to take place as a separate conversation. So take notes on the changes that you see. So you start by observing, You start by observing and writing down things that are objective. And I think that's important that you make your notes that are objective behaviors that you've noticed. And be prepared to talk about your own feelings with the person. Use I statements instead of you, because that will avoid any suggestion of blame or criticism of the person, and they're much less likely to get defensive or angry. Be very gentle in your conversation, keeping the person's feeling in mind. And you want to avoid having the person that's experiencing these changes feel as if they're being ganged up on. It's also helpful if you can kind of practice these in advance with other family members so that you're going to feel more comfortable when you actually have the conversation. And consider and think about the possible outcomes so that you can be prepared for that conversation. This conversation needs to be initiated in a place and time where the person is relaxed, well rested, and comfortable. And when you're having this conversation, it's always good to physically sit close to that person, use empathy, and speak from your heart about these concerns. When somebody in your life exhibits these changes in thinking or behavior, it's important to be aware they could be signs of Alzheimer's or dementia. There are changes that take place that are typical of aging, such as taking longer to remember names. I'm sure we've all done that, or needing a reminder how to use something that you've always used before. But you may start to notice that these issues really go beyond typical aging, like the individual is lost in familiar places, they're withdrawn, especially at social functions. Maybe they ask the same question repeatedly and forget recent events. People with dementia typically first recognize signs that have to do with forgetting, how to do things they used to do. With my dad, what I noticed is he was very confused on his emails or how to use his computer, how to use his telephone. One day I walked into his house and he was struggling to change a furnace filter, which he had been changing for 30 years in this house. So when you start to see things that were normally easy, that tells you that something is probably going on beyond typical aging. Now, it can feel very awkward to approach somebody about the changes that you've noticed, but many times the person has already noticed these changes in himself and has the same concern. But the person may be very afraid. In denial, trust me, denial is one of the most basic ways we have to protect ourselves from being overwhelmed. But the changes might be due to something other than Alzheimer's. And acknowledging this can really help the person take some action. So we're going to hear a video from Donna about the importance of having this conversation.
I think you have to be honest. I think that's the important thing. Get a loved one. I think you have to be honest. I think that's the important thing. Get a loved one to the doctor. I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that because you can't battle something that you don't know what you're battling. Yeah, it could have been, may not have been Alzheimer's, it could have been depression, it could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that.
So suggesting a doctor's visit can be all that's needed to get the ball rolling. Other times, just being honest and direct really isn't enough. And the person needs more support and direction. So here's some ideas that can help. Use words that are most comfortable with that person. Be aware that the person may be sensitive to particular words, such as Alzheimer's. For example, you can say, let's go to the doctor and talk about the fact that you're having more trouble doing things than you used to do, rather than saying, let's go to get an assessment for Alzheimer's disease. Let the person know that it's time for an annual wellness visit. Now, an annual wellness visit is offered at no charge by Medicare since January of 2011. It's a visit for developing or updating a personalized prevention plan that can help prevent the disease or the disability. It includes an examination of the patient's cognitive and behavioral changes and may indicate a form of dementia like Alzheimer's disease. Many older adults may not have ever heard of this, but it can be a very good way of getting that person to get the help that they need. And when you have your appointment with a doctor, try to combine that with something pleasurable. Like we're going to go see your doctor and then we're going to go out to lunch. We're going to go to your favorite restaurant. Another idea is to invite family to communicate concerns and questions to the doctor too. Whether you're able to be there for the appointment or not, you can actually prepare a list of your concerns and questions and provide the information to the doctor before the appointment. Now, we all know that because of doctor-patient confidentiality and HIPAA regulations, the doctor won't be able to speak with you about his or her patient without a signed release. Now, in my situation with my dad, I actually went to and scheduled an appointment with Dad's doctor and shared my concerns. And he was able to talk to me because Dad had signed a release. But, that's when he told me that he had noticed changes too, and that Dad was showing signs of dementia. So however you do it, if you can get those questions answered beforehand, or at least to the doctor beforehand, it's very helpful. Now, if the person is still reluctant, there might be times when you can't talk them into going. And people with Alzheimer's often experience a reduced ability to use good judgment. So sometimes this contributes to the person's reluctance to go into the doctor. In these situations, the person's safety comes first. So you might use a technique that we call therapeutic fib to get the person to visit the physician's office. To get someone to see the doctor, some family member or friends tell the person that the visit is required by the insurance company, or you need to go see the doctor so he can get your medications refilled. And I know this seems uncomfortable at first, but sometimes we have to do these therapeutic little fibs to help get to justify what we get at the end of it. So as we've heard from others, having a conversation about driving may be the most difficult conversation families need to have after the diagnosis. You may notice signs that your family and that their driving habits have changed. Maybe they're having accidents or tickets or moving violations. And you may have seen the person make mistakes when driving the car. Now, personally, this was one of the hardest things that I had to do with my dad. So one of the things that I did, I used the therapeutic fib technique, I guess, a little bit, but I took Dad to get his eyes examined. And I explained to the doctor that, what was going on. And as a result of his eye exam, the doctors told my dad that his eyesight wasn't good enough for driving. And there was some truth to that because he was having macular degeneration. So sometimes we have to be very creative to work through that denial. So now we're going to watch a video, and this is Chris, and Chris is going to talk about this very topic of how he had to ask his father to stop driving.
There's no exact answer on this stop driving. Hell, when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides was a little bit more difficult. And first and foremost, the safety of everybody in the car, as well as other drivers on the road. You think about that, and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad who you love, and you know he loves driving, and he's used to it. He can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful in just saying, medically, you can't do this anymore. But my mother had the hardest time with this. There's no exact answer on.
So whether the changes in driving are due to Alzheimer's or not, here are some ideas that people have found helpful when discussing this sensitive topic. Plan ahead before an accident occurs. Before changes in the ability to drive are seen, talk about the fact that the person will need to stop driving at some point. Many families find it helpful to have an open discussion and develop an agreement about how the person you'd like to notice and what you would recognize that it's time to stop driving, such as noticing more mistakes on the road or new scrapes or dents on the car. So when the time comes, the person may not remember the conversation, so it can be helpful to write notes from your agreement to use later, or even talk to the person to sign a driving contract. With my dad, one of the things that I did is talk about some of the challenges that he had with his parents when he had to deal with them to stop driving. And I don't know if it helped, but I think it did give him a little bit of frame of reference there. Express your concerns about specific changes that you've noticed. Let the person know that you care about and support him or her, and reinforce as the reasons of your concern. And it's important to use specific examples to show that these are real problems, such as, last week you did something really different, and here's what happened, and it concerned me. Appeal to the person's sense of responsibility and concern. For example, you might say, I know you wouldn't want an accident to happen, and for you or for someone else to get hurt. So in this video, we're going to hear from Sheila as she talks about the issue of driving with her father.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or some, will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
So establish a plan for alternate transportation well in advance before you have this conversation. So when you talk to the person, provide reassurance that you want to help them maintain their active social life, and those needs have been included in part of the plan. Once again, it just shows that you are aware of what they might need and trying your best to meet those needs. Incorporate the voice of an esteemed professional and have empathy. And this is, the example I gave of using the optometrist with my dad was one tactic that I used. And he was still very, very hesitant. So I actually contacted our local police department and had an officer come talk to Dad. And he did it in a very empathetic way. He said to my dad that he was not there as an officer of the law, but he was there as a public professional, and he wanted to talk to Dad about his driving due to some of his eyesight issues. And that actually seemed to help Dad more than anything else realize that, this was a serious situation and he could no longer drive. So now Wendy is going to talk about how to use empathy to help with this very difficult conversation.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore, it's like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
So as we've talked about this is one of the most difficult conversations that you have. And so if you go on our website, alz.org, you'll find a document that has, it's called Dementia and Driving Resource Center. And there's a lot of good information and tips that will help you in this situation. So one of the ways that we all provide ourselves with choices that maintain our independence is by making legal and financial plans for our future. Many families do this only to be taken by surprise when dementia enters the picture. So in this video, Chris is going to talk about the topic of dealing with the financial cost of Alzheimer's and dementia.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. So you have to review everything that's in place, see what changes need to be made, both legally and financially. And you have to monitor that going forward afterwards too.
Some people may have plans already in place, but still feel uncomfortable discussing their financial status with you. You may also feel reluctant to do anything that may come across as intrusive, but you need to talk about it. Making legal and financial plans early ensures that the person's preferences and what they want to happen are honored and they're included in the plans, and the family is not making rash decisions. In this video, we're going to hear Julia talk a little bit more about this.
Here's what I've come to after all of this. That it's the most loving and kind thing you can do for them is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you, but I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I told you I'm going to be here with you till the end. So let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay? So that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for healthcare for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. Everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together, and I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
I think it is so very important that we address and honor the wishes of the person. And as Julie talked about the anxiety, it's so prevalent in the person, and anything we can do to help address their anxiety, just by on talking about it. I know with my dad, what I would say to him many times is, Dad, you always took care of me. You were always there for me when I was growing up through the good and the bad. And now I get to pay you back. I get the honor of taking care of you. And it gives that person that sense of they're not so much a burden. It's something that you want to do because you care about them. And so you start by explaining, as she's mentioned, that you're in this together. And these discussions may seem to go against some of our social norms and represent a shift in the family roles. But understand that having this conversation will help you and the person make plans you need to get the best care and allow you to connect, enjoy your time together in the future. It can be tremendously reassuring to let the person know that you'll be a part of the process now and in the future. This way, the person you love can feel that you're on the same team, you're on the same page with them. You start by asking questions and gathering the documents necessary. Think of the conversation as a chance to ask questions rather than tell the person something. And the questions are such as, what documents are in place now and where are they kept? Who has the copies of these documents and who should have the copies? Who should review the documents? Family and other professionals? You pull the documents together and get the ones that need to be completed, altered, or updated in some way. Explain that these are standard plans that need to be made as we all get older. Reduce the resistance to the process by explaining that having these discussions and completing these documents are things we all need to do as we age. When you're having these conversations, try to break it into parts and try different times and locations. If you only had the conversation, if you can try not to have this conversation by phone, try to do it in person. You can also write a letter as well. But don't feel you have to cover everything in one setting. It can help to do the planning in smaller segments. And you can address the person's finances one day and then talk about legal documents another day. I think the best piece of advice is you take this in very small steps so the person can digest it better. You may need to ask a financial advisor to help with the conversation or involve a brother or sister. Some families can make decisions to pool their resources to ensure that care can be provided and the expenses paid. It's important to understand that what the financial situation is, so your family can help make the best decisions on long-term care. Just as having these difficult conversations can be very challenging, caring for someone with Alzheimer's disease is also a big challenge. There's several steps you can take to make things easier for everyone involved. So as our veteran caregivers tell us, no one can do this alone. Everyone who provides care for that person needs to be part of the team, and the care teams work best when there's good communication. You know, with Dad, I was in Kentucky. I had a sister in Indiana and a brother in Arkansas. So we would have three-way calls almost weekly at first and then daily just to talk about it. It wasn't so much that they could do anything because of the proximity, but just having somebody to talk to was helpful. And as with any team, your team works best when there's an open flow of communications and these decisions are made together. The person with dementia or your family members are at the center of this team. And whether the family members live nearby or not, everybody can participate. Families typically look to their primary care doctors to help with making medical plans. Other medical professionals who specialize in certain areas of dementia care may be included to make a diagnosis. Once the diagnosis is made, find out who will coordinate the care on an ongoing basis. Typically, it will be the primary care physician. Now, peers can be a tremendous support to the core team. As the disease progresses and care needs increase, friends can offer much needed breaks in emotional support. Everyone who's working and a member of the care team should contact their company HR department and see if they have an employee assistance program to ask about not only caregiving benefits, but resources to help with the family. Families can look at all their resources and make decisions on how to proceed. There are community resources available where you work and live. Some are even online, so your entire family can have access to that information. The Alzheimer's Association has what's called a navigator, and it's a tool on our website that you can access that allows your family to create a personalized action plan to connect you to family resources, information, and support. So I really encourage you to visit the website and look at all the resources that are available. Remember that no one can provide all this care alone. And the sooner the disease process that you have this conversation, the more smoothly the team can function and provide assistance. Helping the person you're concerned about begins with talking and having these difficult conversations. Just a little tip that we learned with Dad, I mentioned that we did the therapeutic fibs from time to time. And since my brother and sister were in separate states, what I found is that Dad and Mom even too would call one of them and quiz them on things that I had shared with them or told them. So that put brother and sister in an awkward position. So we decided that the best way to deal with that is to have one dedicated person for that communication when those types of strategies are used. So my brother and sister would say, Mom or Dad, Cindy's the one that took care of that. And so you really need to talk to her about it. So in having these conversations, I think the best advice I can give is take it slow. Try to do as much preparation as you can. Know that there's no rubber stamp plan that's going to work in every situation, and really rely on the association to really give you some advice and some guidance. There's a whole plethora of resources on that website. So that concludes the formal part of my presentation. I know we've thrown a lot of conversation out there, but I did want to make sure we had some time for discussion. So I'll open it up now for discussion. Any questions or comments? Let me see what's in the chat room. Oh, it's just somebody had to leave there. Okay.
Well, I just wanted to share that I appreciate your feedback today, and we're just starting on this journey. So you've given me some really helpful information, and I thank you for that.
You're welcome and good luck. And,
thank you.
I always told people it was the most hardest job I ever loved.
Yes, I am sure. I feel that already. So yes. Thank you. I really do appreciate some of your examples and some of even your words. I wrote your words down because I thought they would be helpful to us.
Well, good. And I always tell people that with Alzheimer's and forms of dementia, it does rob the person of most of their brain function in the long run, but it doesn't take their heart. And when the brain isn't recognizing you, the heart is. So just try to keep that in mind.
Well, thank you very much.
You're so welcome.
Thanks, Anne. Does anybody have any questions or comments or maybe ideas that they have used, when having a conversation with their loved one? I love the examples because I think that kind of gives you more ideas of what to do when a situation comes up. If it's resistance with taking meds or having somebody come in the home to help, which I know with my dad, that he kept calling her the cleaning lady. Isn't it nice that Terry got a cleaning lady to help her? And it's like, that's not what she is, but okay, we're just going to go with that right now. And we did. And she was luckily very good about that and kind of went along with that story. But I think caregiver was just a word he couldn't accept yet.
Right.
It just was too hard for him at that point.
You know what, Terry, and that's fine. If
Mhm.
we have to get into their reality because they're leaving ours. And so if you meet them where they are, and if they don't want to call it a caregiver, who cares?
Right. That's right. They're doing the best they can with what
Exactly.
they got. That's exactly right.
Exactly.
Yeah, it's kind of a mantra you have to kind of keep telling yourself, because there's going to be days, right, when everybody's going to get angry and, ticked off because you have so much to do, plus this caregiving thing. And oh my gosh, you got to keep telling yourself they're just doing the best they can.
That's
Take a
right.
deep breath.
And with the questions over and over again, it's so hard on the caregiver because you get irritable, you get frustrated.
Yeah.
And just know that those are normal feelings and we're all there. But, I would try to remind myself that I know Dad just asked me that 5 times in the last 5 minutes, but he has no idea he did. And, it's that circle of life to where, I mentioned how he took care of me and now I'm taking care of him and I'm just giving back.
Yeah. But you got to allow yourself some grace when
Absolutely.
you do get angry. And you know what? We're all human. We're going to do it. We're going to snap. We're going to say things we regret and feel guilty about. But you got to allow yourself some grace because we're just human doing the best we can.
And keep a sense of humor.
Oh,
Because I remember, getting irritable and snapping and then feeling guilty. And then I thought, well, he doesn't remember anyway. So it doesn't matter. So you got to keep a sense of humor.
Yeah. Has anybody had to change any holiday plans? Now that the holidays are coming and the newsletter is going to be coming out soon. I don't know if you all are on. I think a lot of you are on the elder care newsletter. It's the whole thing is about holidays, of course, in December. But has anybody changed plans because of their their loved one? Has anybody had to do anything different?
I will mention, I'd be remiss if I didn't. We do have a Caregiving Through the Holidays program coming up on Friday at 12 o'clock Eastern time. So, we all know that those challenges faced around the holiday season with company or travel. And so we just